My name is Paul Mayer. I'm the Executive Vice President of our Compliance Solutions team here at the Bonadio Group. I've been with Bonadio for just about, we're coming up on 14 and a half years now. Prior to that, I was on the provider side, mostly in the OMH, OSS, OPWDD arena, and have been consulting related to compliance programs over the last 14 and a half years. Our compliance solutions team travels around the state and really around the country for that matter, assessing, developing, implementing corporate compliance programs. With that comes training, auditing and monitoring, assessing clinical documentation and billing, and so on. So we have a variety of services we offer from our compliance solutions team. But today we're going to talk about some of the regulatory environment related to compliance programs and give you some information that for many of you, this might be a refresher. For some of you, it might be an enlightenment. Excuse me. But really just want to give you a sense of what is out there on the regulatory side related to compliance programs and some of the changes that have occurred recently and what you need to be doing or what you should be doing as far as next steps and maintaining an effective compliance program. So we'll dig right in. So as a reminder, there's going to be four polling questions. Please answer them if you want the CPE credits. We'll give you some time to answer those as we go through. Like I said, we're going to talk about the regulatory environment, touch very briefly on this 42 CFR Part 383.85 that's related to long-term care, and then get into the Social Service Law 363D, the New York State Social Service Law 363D that mandates compliance programs in New York State for those that are required. And then the regulations that are important for those to implement the 363D law, the Title 18, Part 516, which doesn't get a lot of fanfare related to the regulations and compliance programs, but I want to make sure that everyone understands that this piece is out there, and we'll get into that a little more detail later on. And also, of course, the Title 18, Part 521 regulations. These are what kind of govern you carrying out the Social Service Law 363D and advise it or gives you those regulations of what you need to be doing for to be compliant with the regulations and the law. What should you be doing now? And then I'll touch on our Bonadio reality tour, what we call our reality tour, and it's kind of what we see throughout the provider community around the state, around the country. Me and my team review in some capacity upwards of 130 to 150 providers, all sorts of provider types, whether it's counties, nursing homes, hospitals, health systems, small clinics, large clinics, home care agencies, and so on. So we get a good broad sense of what is happening out there in the community from either good things or not so good things that you all should be aware of. Take that information back to your own organization and see, we have some of these good things in place? Have we achieved best practices in some areas, or do we have a bunch of areas that we're not so sure about we should pay particular attention to? Okay. A little bit of background before we delve into some of these regulatory environments. Just a little history of corporate compliance back in 1997, when we really first see formal compliance plans come in place, a model for compliance plans in regards to clinical laboratories. And then following, over the next few decades, we see a rollout from both the federal level and then as we move on the state level. But in 1998, hospitals, home health agencies, third-party billers, formal models for compliance programs. 1999, durable medical equipment, hospice, skilled nursing facilities. We put HIPAA here, even though the HIPAA law went into place early on, but it's a good spot prior to 2006. In 2003, the HIPAA privacy rule went into place, and I believe 2004, the HIPAA security rule. Next is the Deficit Reduction Act of 2006, and then we get to the Social Service Law 363 that I mentioned earlier in 2006 as well. The OMIC legislation for Social Service Law 363D went into effect. And then we have the Affordable Care Act, 2013, touches on nursing home requirements. And we'll get into this one a little bit later as well, but in 2019, for long-term care facilities, the 42 CFR 483.85 regulations went into effect. And then, again, April 1st, 2020, along with the laws of New York State, the Social Service Law 363D was amended, and those went into effect April 1st. So we'll get into some more details on that in a little bit. So as I mentioned, long-term care facilities, and we're going to roll through these. What I want to emphasize is that if you're not familiar with these regulations and the laws, take this back. We've cited them. Review them themselves. There's a lot of detail here. A lot of detail within the regulations, within the federal requirements, within the state requirements that really you need to appoint somebody, if you haven't already, to lead that initiative of keeping track of what's going on in the regulatory environment. That's a key point of this, key takeaway is that you really need someone that's in charge of keeping track, looking at the details of the requirements, of the regulations, of the law, so to make sure that you are compliant with the components that are within. So this one for long-term care facilities went into effect November 28, 2019. Operating organization for each facility must develop, implement, and maintain an effective compliance and ethics program. So this is for people on the call that either have a standalone long-term care facility or you have one as part of your overarching organization. For organizations with fewer than 5 facilities, there's 8 elements of a compliance program. For those with 5 or more facilities, there's 11 elements for organizations. So again, refer back to the federal regulations, 42 CFR 483.85, for specifics on that. Now, what's interesting, well, the last one here, CMS and the state survey agencies are now authorized to issue deficiencies under the federal FTAG F895 to facilities that do not have an effective compliance program. So it's very important. Go back to those regulations, these requirements that went into effect November 28, 2019, and assure that you are in compliance there. Before we go on to that polling question, I just want to make sure, reiterate that within this requirement at the federal level, if you are a long-term care facility, there is quality of care components as well as the compliance requirements and training requirements. So really refer back to that. I'm not going into great detail on these, but it's just important for you all to know if you operate these type of facilities. November 28, 2019, it was updated. The requirements were updated and added additional components that you need to be aware of. Now, with that being said, in July 2019, there's a further update that has not gone into effect yet. So it's another where I mentioned at the beginning that someone really needs to be tracking these requirements and effective dates. There's proposed updates to these federal regulations for long-term care facilities that went into effect November 28, 2019. July 2019, there's proposed updates and amendments to those requirements. So when will we get those? I don't know, but it's something that you need to monitor and keep track of when those are going to be released and keep track of those effective dates. All right, so we'll move on to the first polling question that I'm going to launch right now. that launched? Yes. Does your organization have a formal system for monitoring regulatory changes? And as I mentioned, it's very critical that someone, whether it's your compliance officer, any other function, is responsible for keeping track of any regulatory requirements that affect your organization, your program types. So for those that either that are saying no to this question, you know, it's an important takeaway. At this point, go back to your organization and find out, okay, who's in charge of this piece? You know, there's some regulatory changes that may be affecting us. You know, certainly with COVID-19 and some of the waivers that have gone in place and some of the changes that have occurred over the last 10, 12 months, it's important to be tracking those things and when they're effective, when do they go away, and so on. Okay, so we'll move on. As a reminder, we had several that didn't answer the question. If you want the CPE credits, there's 3 more opportunities. Make sure you answer those questions and click submit to those questions. Okay. So moving on, another important piece, the New York State Social Service Law 363D. Want to make sure. Okay, there we go. Created as part of the Chapter 442 OMIG legislation in 2005, requires Medicaid providers develop and implement compliance programs aimed at detecting fraud, waste, and abuse in the Medicaid program. This is the law, and as I mentioned, it was amended April 1st, 2020. The regulations that carry out that organizations have to follow to carry out the law are the New York State Codes, Rules, and Regulations, Title 18, Part 521. They define the compliance program requirements. Okay. And to answer one of the chat questions, no. The question is this session only for long-term care? No, I just wanted to make sure we touched on that particular regulation first before we delve into the others, because it was relatively new and it's something that we expect to be updated at some point in the near future. So I'll try to answer these chat questions as I go through. I'm gonna, as we get to the next polling question, while everybody's answering the poll questions, I'll try to go through some of these questions in the chat. Okay. So OMIG provider compliance programs, as most of you should know or all know, providers receiving or claiming in excess of $500,000 over 12 months, plus Article 16, 28, and 31 clinics must have a compliance program. You know, we'll see in a minute that the Social Service Law 363D amendment added a few other things, but we'll talk about that in a minute. This authorizes OMIG to audit provider compliance programs. Providers can be excluded from participating in the Medicaid program for noncompliance. We'll see in a minute that OMIG has, or New York State has elevated and added some teeth behind noncompliance, Medicaid compliance programs. Effective compliance programs is a requirement in the law and the regulations. In the regulations as it stands now, Part 521 of Title 18, every required provider shall adopt and implement an effective compliance program. What does effective mean? Well, it's really up to your individual organization, but really you need to be clear on what you define as an effective compliance program and why you feel it's effective for your organization. Now, keep this in mind, that required providers compliance programs should be applicable to billing, payments, medical necessity, and quality of care. As everyone knows, medical necessity is a requirement for billing Medicaid. Your services have to be medically necessary. You have to demonstrate in your documentation that those services are medically necessary. Governance is an important piece. Your compliance program has to be applicable to governance. Mandatory reporting, credentialing, making sure everybody has the correct credentials and maintaining those credentials and documenting and supporting that you are keeping track of those things. And then the last one in bold here is the catch-all, is what I always call the catch-all, and people have heard me talk before. This is where these regulations kind of capture the all-inclusive other risk areas that are or should, with due diligence on your part, be identified by the provider. So that's, an all-encompassing statement where, you have risk in your organization. Your compliance program should be applicable to the risks in your organization. How do you know what your risks are? Well, you have to assess, you have to monitor, you have to audit your policies and procedures, laws, rules, and regulations, and other areas that guide and provide oversight to your programs that you operate. So what are the 8 elements in the Part 521? And I know this is a review for most people. I'm not going to go into these each one of these 8 elements in depth, but it's just a reminder. Your compliance program has to address these 8 areas, at minimum, these 8 areas, to be deemed and effective, which is required by the law and the regulations to be effective compliance program. So if you don't have one of these elements, you don't address it, you don't mention it, OMIG will say you don't have an effective compliance program because you did not address each one of these 8 elements. Okay, element number 1 is having a set of policies and procedures and a formal code of conduct that guides your compliance program activities. Element number 2, compliance program oversight. What does that mean? Well, you've designated and have people that are overseeing your compliance program. You've designated a compliance officer. You have a compliance committee. Your board has ultimate oversight and responsibility for the operation of your compliance program. Okay. Element number 3, you're having a training and education program to educate your staff and contractors and anybody affiliated with the organization about your compliance program and the requirements of your compliance program and what their roles and responsibilities are related to your compliance program. Element number 4, having an effective confidential means of communication, such as a hotline. How do people report issues and concerns related to potential noncompliance or actual noncompliance? How do you communicate that out to your staff that you do have this avenue to report and what's expected of them as far as reporting? Element number 5, enforcement of compliance standards. Okay, you have all these policies and procedures related to your compliance program and the standards that you've set for your staff and contractors and vendors and whoever else. But if you don't enforce, you don't have a disciplinary action policy and procedure related to noncompliance, likely people aren't going to take it seriously. And so this is one of the reasons why this is a requirement in the regulations and the law, is that, it's not enough to have something sitting on your shelf in paper form that's been sitting there for 10 years. You've never looked at it. People don't know about it. And therefore you think that, your compliance program is functioning. No, it doesn't work that way. You need documentation. You need proof that you are addressing each one of these areas. You are assessing each one of these areas on an annual basis. You are enforcing noncompliance in an effective way and a fair way throughout your organization. Element number 6, having a process to identify those compliance risk areas. We talked about that earlier as far as in what your compliance program should be applicable to. And somebody asked the chat just now, can I give an example of those other areas, the last piece in the bold type, other areas that you should, with due diligence, identify as a provider? Well, some of those other areas, might be your facilities, or certainly on the technology side, security, HIPAA security, IT security. Some of these are other areas, HIPAA in general, HIPAA privacy. these are some of these other areas that we're talking about that could have great impact on your organization, that they should be part of your compliance program. You name it, any other area, law, rule, and regulation, guidance that, your either funders, your grant compliance is a huge area as well. Any contracts you have, who's really checking these areas to see what risk there may be to your organization, and are you covered in those areas? And then when you've identified risk areas or someone's reported issue or concern, element number 7 here is responding and having a response and resolution and follow-up to those things that you've either identified yourselves or somebody has reported, to determine, is it warranted, is there a real risk here, if there is a real risk, how are you going to mitigate those risks going forward, and then what systems have you put in place, corrective actions, or other re-audit process or follow-up to ensure that those risks are mitigated going forward. That's a key component to a compliance program. The identification of compliance risk areas and response, resolution, and follow-up, in my opinion, are 2 of the most key elements of a compliance program. And what you do with those, the follow-up and resolution, corrective action process is critical to any compliance program. Then element number 8, having a policy of strict non-retaliation and non-intimidation for reporting of issues and concerns. These are critical. This is required. It's the law. And you do need to emphasize both of those components, non-retaliation and non-intimidation, within your documentation practices, your training, and everything else. OMIG looks for both of those components when they're assessing your compliance program. So if you haven't addressed non-intimidation, but you have a really strict non-retaliation policy, the governing authorities will say you don't have an effective compliance program because you did not address anywhere the non-intimidation piece. Okay? Moving on. As I mentioned, the New York State Social Service Law, Section 363D, was amended as part of the laws of New York in 2020. It was approved April 1st, 2020, went into effect April 1st, 2020. And then in a little bit, we'll talk about this key component, the fines and penalties that are effective 1/1/2021. So this past January, these fines and penalties for not having an effective compliance program go into effect. We'll talk about those shortly. So polling question number 2, let me launch that, and then I'll get to any of the questions that I haven't talked already. So let's see. Poll 2. Poll is open. Do you have plans for formal comprehensive compliance program assessment in 2021? Remember, not a right or wrong answer here, but if you do want the CPE credits, just make sure you answer the questions. Okay, while that's going on for the next minute, I'll look through the chat. One person comments, we don't have a formal person in place, but they do have a person that keeps track of the regulatory environment. That's good. You don't need it formalized, but just make sure that there is somebody, and ideally somebody would report back to either the compliance officer or the compliance committee of those things that they are keeping track of. That's very important. Okay, I guess I've covered the chats. Okay, we're almost out of time for polling question number 2. And as far as assessing a formal comprehensive assessment, we recommend that you do it annually, or at least part of your review process, or review your compliance annually. OMIG, prior to December 2021, wanted you to complete their formal self-assessment tool every year before certifying the compliance program. As most of you know, that annual certification process has changed And before we get on to these key changes of Social Service Law 363D, I'll mention that component. Back in October, I think it was, OMIG came out, or late October, I guess it was, of 2020, said that they were no longer requiring that annual certification of your compliance program. It's now going to be part of your annual process for billing Medicaid, that annual certification process. And if some of you have seen it so far already, you'll see within the narrative of where you're signing off that you're certifying your billing Medicaid, that part of that process, there is components in there that says you are also certifying that you have an effective compliance program that follows the social service laws and the Title 18 Part 521 regulations. So, in fact, you are certifying, and for some of you that have multiple NPI numbers, it goes back to when this annual certification is now part of your annual enrollment to billing, and it's based on when your first enrollment date, so your anniversary date. So some of you that have multiple NPI numbers may have multiple times throughout the year that you have to certify your compliance program. And one of the key areas that I've been telling people is, don't just have somebody sign that and certify that you have an effective compliance program if they're not aware of your compliance program and they're not aware of your compliance program activities. And in fact, it is effective. I think, and we'll talk about some of these changes to social service law where I think that is going to be a critical component of potential fines and penalties later on. Okay, so some of the key changes in the Social Service Law 363D, we mentioned the clinics that were required and the $500,000 threshold. Social Service Law 363D now has, and I think I've said Social Service Law 363D probably 10 times already, so you should, by the end of this session, at least have memorized that citation for the state law for compliance programs. So it's deliberate. I want that ingrained in your minds that, okay, compliance programs, Social Service Law 363D. At any rate, managed care companies and managed long-term care companies have been added to the list of those required to have compliance programs. Makes sense. It's logical. It's, why weren't they included before? Some of the other ones are outsourced billing companies that are required to have a compliance program. Compliance programs shall meet the requirements in the law as a condition of payment from the medical assistance program. And so, we talked about the certification. I think this is where OMIG decided, well, it's a condition of payment from the medical assistance program. Compliance programs, it's in the law now. Compliance programs shall meet the requirements in the law as a condition of payment. So that certification process, that annual certification that's linked to your NPI number now, I think that's where OMIG said, well, you're going to certify it as part of your NPI billing Medicaid annual certification process. So, maybe it's an efficiency piece on their end, but they're linking it, and I think deliberately, this is my opinion, it's not supported by any law or anything, but in my opinion, they're linking it back to you all the providers, certifying that condition of payment for the medical assistance program. So, we'll talk about the other key component to that I think is critically necessary to understand from all of your parts. Another key change is to designate a compliance committee who report directly and are accountable to organization's chief executive or other senior management. In the regulations before, in the law, that designating a compliance committee was not a requirement. Now it's a requirement. You have to have a formal compliance committee who reports directly and are accountable to organization's chief executive or other senior management. Now, some of the questions I've had in the past, well, what does that mean if we have a board compliance committee? Excellent question. I don't have an answer to that right now. Hopefully when OMIG updates the Title 18 Part 521 regulations, we'll get some clarity on that component. who is supposed to be on the compliance committee, and also how often is the compliance committee supposed to meet. I suspect, and this has been some of the guidance from OMIG in the past, that they will give us some guidance on who should be on the compliance committee, but also, but also how often does the compliance committee meet? And in the past, they've given the guidance that they expect quarterly, or the guidance is quarterly compliance committee meetings. I think they're going to define that frequency of the compliance committee. So those organizations that set a quarterly meeting, but maybe only meet 2 to 3 times a year, I don't think that's going to be okay going forward. I think you're going to have to reschedule those and make sure you hit at minimum quarterly. At least that's been the expectation in the past, from OMIG's mouth in the past as well. How can you have an effective compliance program if the compliance committee, who is assuring that you're carrying out the compliance function and assisting with that, only meets 1 or 2 times a year? You know, so that's the argument for having more compliance committee meetings. And as far as who should be on the compliance committee, we don't know that yet. From Bonadio's perspective, we like to see a good cross-section of your organization, as well as at least one board member sitting on the committee. But there's, as some of you have participated in the past, we had a seminar we put on over a year ago now that talked about the structure of compliance committees and how many providers are satisfying that function, the compliance committee, in many different ways, whether it's a board committee, a workforce committee, a combination of both. But that's, you know, hopefully we get some more clarity from OMIG, or, you know, however you can do it that demonstrates, at least at this point, without clear guidance and clear regulation, how you can have an effective compliance program with how you have set up your compliance program at this point. Okay. Designated compliance officer who reports directly and is accountable to organization's chief executive or other senior management. To note here, the law has removed the employee component of the compliance officer. So in the past, it said designate an employee with the function, with the responsibility to carry out the compliance function, or an employee as a compliance officer. No longer does it say employee. So, you know, OMIG, for those of you who are familiar with it, OMIG several years ago said that, I think it was 2013 or 14, said that the compliance officer needed to be a W-2 employee of the organization. In the law amendment of 4/1/2020, it's removed that employee designation. So, you know, how that impacts you may or may not, but, you know, it's worth noting. Lines of confidential communication must also include first tier, downstream, and related entities. What these exactly are and what the state is defining first tier, downstream, and related entities, it's not defined at this point. So hopefully there'll be some clarity from OMIG. But, you know, related entities, it's kind of clear that, you know, your hotline or whatever reporting structure needs to also include these other areas that are part of your organization. Routine auditing and monitoring should include internal auditing and monitoring and audits, and as appropriate, external audits to evaluate compliance with medical assistance program requirements and overall effectiveness of your compliance program. So going back to that first polling question, or was it just the second, where we asked, do you have in your plans for this year to do a formal assessment of your compliance program? Well, right here, one of the key changes in the social service law is that you need to assess, your part of your normal auditing and monitoring process now is to evaluate compliance with the medical assistance program requirements and overall effectiveness of your compliance program. So that's got to be formalized at this point based on this change in the law. Whether or not you do that internal, external, that's up to you, but you have to formalize that process now. And then it's training and education, obviously annually and part of new hire employee orientation. Also part of new appointment of your chief executive, manager, or governing body member. Okay. So this is the one where I think it's critical now when you're certifying your compliance program, whether it's through your billing office, finance, whoever's getting those letters for your annual update to be able to bill Medicaid. Fines and penalties where the state has added teeth to the compliance program requirement. Okay, effective 1/1/2021 for any compliance program assessment done after that date, these fines and penalties could be levied against you. First offense of noncompliance, of being deemed not having an effective compliance program. And remember how I said if you didn't have the word non-intimidation in there and you're deemed to not have an effective compliance program or somewhere in your policies and procedures or training or wherever, you could be deemed as not having an effective compliance program, $5,000 a month up to 12 months. So this up to 12 months, I think there's probably an opportunity to fix things as you go forward and get things in place, and maybe that time frame will be shrunk to whenever you've been deemed to have addressed the issues that were identified. Subsequent offenses, $10,000 per month up to 12 months. So it's key, go back to the social service law that went into effect 4/1/2020, review it, make sure that you are addressing those areas that you need. And I think, where I said I think this is kind of matches up with the putting the emphasis onto where we're certifying your compliance program when you're re-upping your billing certification to be able to bill Medicaid on an annual basis. Never want to have somebody just signing off, yep, we're effective, if they're not part of the process, if they haven't communicated back to the compliance officer, we're signing this, we're okay to sign with this, or your chief executive or whoever, because you are certifying that you have an effective compliance program. Now, what does that mean? Well, if then you receive a Medicaid audit where you have $1 million payback or whatever it might be, $100,000, $200,000, whatever it might be for your organization's size, could OMIG come back and say, you don't have an effective compliance program, you just had to pay us back $500,000. How can you say you have an effective compliance program? We're going to hit you with this offense, fines and penalties. So, that's a speculation on my point, but it seems to be reasonable now that they've added this fines and penalties. It's added some teeth behind that the term effective compliance programs. It seems like the steps that have been made kind of make sense to this new fines and penalties, this teeth added to compliance program effectiveness, where they're going to start utilizing this. This is a question that came in. So what happens when you don't sign a test because you just had a big payback and don't want to falsely attest that your program is effective? Very good question. If you can attest because you don't think you have an effective compliance program, because you just had a big audit finding, I would talk to OMIG about that. They're really, at least historically, have been receptive to you asking those questions. Look, we just had this audit results. We're implementing steps in place to mitigate it going forward. We want to be able to certify, but we think that this could be deemed as not effective. We want to make sure that we're doing the right thing. So I think it's okay to ask those questions or have someone ask those questions on your behalf. It's a very good question. I think at this point you have to certify based on your documentation and practices you have in place that you deem effective. Now, will there always be overpayments and results from audits? Yes. Things get missed, if it's a huge finding, then yeah, you might want to rethink of what you're auditing and monitoring. But it's a good question. It's something that you probably should reach out to OMIG and ask them about it, or have someone reach out on your behalf, because You certainly don't, if you feel you don't have an effective compliance program, you definitely should not be certified. Make sure you have an effective compliance program before you certify, have all the things in place. Are there going to be audits and findings? Yes, but make sure that you can demonstrate on your end that you have an effective compliance program. All right, so the other key changes, there's more in the law, so make sure you read the law. They really have published a detailed self-disclosure process and detailed overpayment process. So, look at those for the steps to take when you have when you've identified an overpayment or the need to self-disclose. Polling question number 3, and I'll answer some of your additional chats while this is going on. Let me load this in. The poll is open. And has your organization reviewed the amendments to Social Service Law 363D? Let me go back to the chat questions. What is the rationale behind not requiring CCO to be an employee? Good question. That has not been published in any way. I can speculate. Some of the smaller providers who are having difficulty filling a compliance officer role, which they're, for over the past couple of years, 2-3 years, there's been, at least that come to my attention, many providers that who may have, $500,000 annually of Medicaid revenue, or a clinic that's required to have a compliance program that just can't, are having a hard time hiring it for that position, or can't add the responsibilities to another employee's plate. So, they're having difficulty filling those functions, and or they just don't have the money to pay a full-time compliance officer or whatever it requires. Some of you have participated in our seminars in the past. You've seen some of the results of our compliance officer polls or our compliance workforce polls, organization compliance polls. The field of compliance has progressed over the last 15 years, 20 years. And with that progression becomes more experienced staff. Obviously, the requirements on compliance officers and responsibilities on the compliance function, those responsibilities have expanded. When we first came into compliance programs, compliance officer didn't HIPAA wasn't around, for one, or HIPAA was around, but compliance programs first came on board, the compliance officer wasn't responsible for HIPAA or wasn't responsible for Justice Center incidents, investigations, and so on. I have some compliance officers who are responsible for HR function, responsible for IT function, responsible for HIPAA and Justice Center investigations on top of their compliance officer role. So, if you're a small organization, you know what I'm talking about. And so it's very difficult to, when you have turnover, to get somebody in that's, number one, willing to take on all that responsibility for not a large salary, because as we know, the field has progressed so much that salaries have progressed as well. So it's a tough area to speculate on, but I think that's really what's behind that. To give some wiggle room for some of these smaller agencies to be able to get a compliance officer that is experienced. Okay, moving on. Okay, so I'm having a little difficulty here, so I'll move this here. So Title 18, Part 516, it hasn't really received as much fanfare in the past as the Title 18, Part 521. But it's important to note that it was just amended, and I think it was amended September 2020. If I'm mistaken, somebody can let me know, and I'll say when it was. But in 2020 for sure, and as a result of the amendments to the social service law, this is the monetary penalties piece of the regulation. So it's another regulation under Title 18, Part 516 the monetary penalties come into play. And I'm not going to go into detail. I want you all to go back to Title 18, Part 516. If you go on the OMIG website, it's one of the most recent regulations that was amended. In the future, we're going to see Title or Part 518 and Part 521 being amended as well, and that we want to make sure everybody keeps their eyes open on that. But so monetary penalties, part of Social Service Law 145B, and you can go back and research these components, but it says when a person fails to grant timely access to records and facilities, you could be levied monetary penalties now. A provider fails to report, return, and explain overpayments within 60 days of identification. This follows suit with the federal requirements of, when you've identified an overpayment, you have 60 days to report, return, and explain. It's the self-disclosure process. So in the Social Service Law 363D, they've really outlined that return of overpayment. They've gone into detail. This levies monetary penalties to not following those requirements. Okay, excluded individuals or entities. Monetary penalties are now applied when an excluded individual or entity is found. Social Service Law 363D, we talked about this, failure to adopt and implement an effective compliance program. So these monetary penalties are outlined in the Part 516, Title 18, Part 516 regulations. Social Service Law 364-J, a managed care provider submits a cost report to DOH containing a misstatement of fact. Monetary penalties now can be applied right in the Title 18, Part 516 regulation. So I want to talk about on that piece. I do want to save room to answer some of these chats and go through the rest. But it's important, and I talked about it up front. Designating somebody, whether it's official or formal or whatnot, review these requirements, review the laws, review the regulations, and make sure you have a solid foundation, solid understanding of what's contained in there, because some of the stuff might be a surprise to you. Oh, I didn't know that. Never heard of Title 18, Part 516 before. Title 18, Part 518. Those are all things that you should be aware of, including the Title 18, Part 521, which outlines the 8 elements of a compliance program. So this is just real quick. We have 11 minutes left. A little bit of our reality tour. Some of you may have heard this already, but it's good if you haven't heard us talk and seen this before. It's a good indication of what we're seeing out there in compliance programs around the state. So, if you tell us something, call us, and you can call us anytime if you have a question. But if we hear something that's going on in your organization, chances are we've seen it already. It's rare that I come across something new that surprises me that we haven't addressed in the past, at least in some way, shape, or form. So these are a few little areas that we've seen over the last year in our review of compliance programs and our discussion of compliance programs with providers around the state and elsewhere. No system for regular review of compliance plan and compliance policies and procedures. Now, as we just talked about, this is part of the law going forward. Part of your auditing and monitoring has to have a routine system to assess the effectiveness of your compliance program. So that includes reviewing your compliance plan and compliance policies and procedures. Some people try to do it. Maybe they never do it unless there's a change, or they do it annually or semi-annually, whatever it might be, or every couple of years. This is the law. You need to have a regular review of effectiveness of your compliance program. Lack of compliance program policies and procedures to support the operation of the compliance program. So we're still coming across providers that don't have this formal policies and procedures to support the compliance program. That's a requirement in the law. Element number 1. Policies and procedures haven't been reviewed or revised, not reflective of current practices. I just reviewed a compliance program yesterday that the compliance plan on the website, on the provider's website, was not the current plan in place. So, and it was a compliance plan that was set in place in 2014. There's been subsequent reviews. So it's just making sure that you, number one, your current practices are reflected in your policies and procedures and the compliance plan. And also you have the right ones posted where they're supposed to be posted. Okay. Next one, inadequate or lack of direct communication between the compliance officer and governing body. We like to see regular communication with the compliance officer and your board. We like to see at minimum one executive session per year with your board. Some people go to some compliance officers go to every board meeting, but don't do an executive session. We recommend at least one executive session. That means all management staff removed from the room except for the board members and the compliance officer. Could be a minute long. Any questions, any concerns? Board should be asking some good questions. How things go? How do you feel? What do you need? Those kinds of things. That displays that transparency. It displays that you're trying to have an effective compliance program. And along those lines, use that one meeting to provide education, compliance training to your board, your governing body. We're still seeing that the board is not trained on an annual basis, or initially, for that matter. Compliance training not provided to all effective individuals, board, executive staff, employees, contractors, vendors, all those folks. Anybody who's required to have a compliance training, they all need to be trained. If you don't train all those people that are all the effective individuals, then you could be deemed out of compliance and not have an effective compliance program. Compliance training outdated, is generic, does not include some of the relevant laws, rules, and regulations. Does it mean you have to have just one compliance training per year? No, it should be part of your standard. It should be part of anybody's training and services. There should be a compliance function. Take credit for what is being done, certainly, but also make sure you're reviewing your compliance training and make sure it's up to date with relevant laws, rules, and regulations. If you're doing a training in 2021 and you're not including that Social Service Law 363D changed, and this is how it affects us, well, that's something that you should incorporate this year. Okay. Compliance officer not informed of exit surveys with employee separations, terminations. We like to see that the compliance function is included. What areas of concern might that departing employee have on your organization? Is there something key and critical for the compliance program? Having repeated findings on any audit or survey activity could be deemed as having an ineffective compliance program if you have repeat findings over and over again. Exclusion screening not conducted on certain individuals on a monthly basis. We're still seeing that. We talked about risk assessments, risks not incorporated, identified risks not incorporated in your work plan or an audit plan. Those are key areas. And overpayments and billing errors not being reported to compliance committee and the board. People need to be aware of what's going on in your compliance program. Corrective action plans put in place and not being monitored going forward. Those are critical. We talked about that resolution, element 7 of the compliance program. Resolution and follow-up process for any corrective actions or risk areas identified. Those are critical for an effective compliance program. So what should you be doing? We have 2 minutes left. Monitor, test, assess, identify risk areas, implement corrective actions where needed, follow up to make sure those corrective actions are working, train your staff, And most important, well, not most important, they're all very important. But for the purposes of this session, stay abreast of the regulatory environment. When are things changing? When did they change? When, for example, during the pandemic, those waivers, documentation waivers or whatever they might be relative to your specific programs. Telehealth, we didn't talk about telehealth and telemedicine at all, but that's a key change to the way people operate. And what regulations do you need to be aware of? What requirements for your specific organization, your specific policies and procedures do you need to stay on? Keep track of those effective dates. When did one rule change and one go into place? When did it go back, revert to the way it was, if ever? All of those things you need to track. Okay. Polling question number 4. Let me launch that. Oops. Okay. How many full-time equivalent staff are in your compliance program? This goes back to what we were talking about before, as far as having the resources, having the ability to carry out the function, the compliance function. So again, make sure if you want the CPE credits, make sure you answer the question, click submit. And I'm going to move on. What do we expect? Expect OMIG to update the Title 18 Part 521 regulations to fit with the standards of Social Service Law 363D. They're going to put the updated regulations out for public comment. We expect this to occur. Well, we don't know. A reliable source, I won't disclose that source, but originally we thought September, October, those regulations were going to be in place, or at least out for public comment. Now we're hearing sometime this summer. Obviously, OMIG is busy doing their thing, and with the pandemic, it's a little difficult to get things written and approved to fit within a short time period. So we're expecting June or July. Could that be pushed out even further? Yes. So we just don't know. But that's, from what we're told, that's the process. They're gonna update the regulations, put out for public comment. Can they avoid public comment process? Yes, I think they can issue an emergency release or whatever it's called. But at this point, that's when we're expecting. So we follow the current regulations, follow the current law. That's the message we're sending here. And then for those long-term care providers on this call, keep track of the 42 CFR 483.85 that went into effect 11/28/2019, but be on the lookout for those proposed revisions that were written 2 Julys ago, I guess 7/18/2019, but they're not yet effective. So you got ones that went into effect a little over a year ago in November of 2019. But at the same time, there's proposed revisions from July of 2019 that are yet to be effective. So you need to just stay on it and keep track of those. You need to have an effective compliance program that satisfies the current laws and regulations at both the state and federal levels. Okay, so if you want to stay on for one more minute, I'll see if I can answer a couple more. Somebody just said technically everyone in the company is part of the compliance program. Yes, that's absolutely true. So if your auditors, the question is, if your auditors review your compliance program as part of the annual finance audit, would that count as a regular review? Good question. From my perspective, that compliance program review is limited than what you need to determine you have an effective compliance program. It's much more comprehensive than what would be done as part of those financial audit reviews. Okay, so you need to do a much more detailed, comprehensive review of your compliance program compared to the brief review that's done as part of your annual financial audit. Last question, and then anything else we'll get to as far as I'll answer questions and get out any chat questions. I'll answer formally and get out the responses. Last question, does the 60-day clock start when you have identified the dollar value of the overpayments versus when the investigation into it begins? The answer is, and I'm not an attorney, but from dealing with many law firms and the government, the 60-day clock starts when you've identified the dollar amount of the overpayment. It doesn't start because when you start an investigation, you haven't determined whether or not, and this is critical for your compliance people, you haven't determined whether or not there's an overpayment. You're just starting the investigation. You're just doing the investigation. So, that whole process, you haven't really come up with the overpayment process. So I will get to answering all these questions and get them out to you. The slide deck will come out to you as well. We really thank you for participating. And again, any answers not answered or any questions not answered, or if you have additional questions, feel free to reach out to me anytime, and I'll get the rest of these questions answered formally for you all. Thank you, and have a great day. Stay safe in the snowstorm if you're part of the snowstorm, and we'll talk to you soon. Thank you.